What is the cause of HIV?
HIV is caused by a virus. It can be spread through sexual contact or blood, or from mother to child during pregnancy, childbirth, or breastfeeding.
How does HIV become AIDS?
HIV destroys CD4 T cells, white blood cells that play a large role in helping your body fight disease. The fewer CD4 T cells you have, the weaker your immune system becomes. You can have an HIV infection with few or no symptoms for years before it turns into AIDS. AIDS is diagnosed when the CD4 T cell count falls below 200 or you have an AIDS-defining complication, such as serious infections or cancer.
How HIV spreads?
To become infected with HIV, infected blood, semen, or vaginal secretions must enter your body. This can happen in several ways. First, by having sex. You may become infected if you have vaginal, anal, or oral sex with an infected partner whose blood, semen, or vaginal secretions enter your body.
The virus can enter your body through mouth sore or small tears that sometimes develop in the rectum or vagina during sexual activity.
By sharing needles.
Sharing contaminated IV drug paraphernalia or needles and syringes puts you at high risk of HIV and other infectious diseases such as hepatitis. From blood transfusions. In some cases, the virus may be transmitted through blood transfusions. American hospitals and blood banks now screen the blood supply for HIV antibodies, so this risk is very small.
And during pregnancy or delivery or through breastfeeding.
Infected mothers can pass the virus onto their babies. Mothers who are HIV positive and get treatment for the infection during pregnancy can significantly lower the risk to their babies.
How HIV doesn't spread?
You can't become infected with HIV through ordinary contact.
That means you can catch HIV or AIDS by hugging, kissing, dancing, or shaking hands with someone who has the infection. HIV isn't spread through the air, water, or insect bites.
Risk factors for getting infected with HIV.
Anyone of any age, race, sex, or sexual orientation can be infected with HIV or AIDS. However, you're at greatest risk of HIV or AIDS if you, first, men having sex with other men, have unprotected sex, a history of sexually transmitted disease, victims of sexual assault, exchanging sex for money or drugs or having sex partners who do, being accidentally stuck with a needle or sharp in a healthcare facility, people who receive a blood transfusion or other blood products before 1984, or blood products were not routinely screened for HIV prior to 1984. Use IV drugs.